How does endoscopy technology work to diagnose GERD? Imagine being able to see inside your body without surgery. That's what an endoscopy does. It uses a tiny, flexible tube called an endoscope, equipped with a camera and light, to look inside your esophagus and stomach. When doctors suspect gastroesophageal reflux disease, or GERD, they often recommend an endoscopy to get a clear picture of what's happening. The process starts with you swallowing the endoscope, which then gently slides down your throat into your esophagus and stomach. As it moves, the camera transmits real-time images to a monitor, allowing your doctor to see the lining of your esophagus directly. They look for signs of damage caused by acid reflux, like redness, erosions, or swelling. Sometimes the lining may show strictures, which are narrowings caused by scarring, or even changes called Barrett's esophagus, which can be a warning sign for more serious issues. If the doctor spots suspicious areas, they can take small tissue samples called biopsies through the endoscope. These samples are examined under a microscope to check for inflammation, precancerous cells, or other problems. This helps confirm if GERD is causing the damage or if something else might be involved. While endoscopy is great for spotting complications, it doesn't always show damage in every person with GERD. Many patients with reflux symptoms may have a normal-looking esophagus during the procedure. That's why doctors often use endoscopy when patients have warning signs like difficulty swallowing, bleeding, or unexplained weight loss. Advanced endoscopic tools have made diagnosis even better. Magnification endoscopy enlarges the view, making tiny abnormalities easier to spot. Narrowband imaging and chromoendoscopy use special dyes or light filters to highlight mucosal patterns and blood vessels, revealing early tissue changes. Confocal laser endomicroscopy offers a microscopic view of tissues during the procedure, almost like doing a tiny biopsy in real time. There is also wireless capsule endoscopy, where a small camera capsule is swallowed, and it transmits images as it travels through your esophagus. This method is less invasive and can be useful in certain cases. In summary, endoscopy works to diagnose GERD by allowing doctors to directly see the inside of your esophagus and stomach. They look for signs of damage caused by acid reflux and can take tissue samples if needed. The use of advanced imaging techniques helps detect even subtle or early changes, making endoscopy a valuable tool in managing GERD and its complications.